For 7 years, fresh-baked cookies have arrived at the Mary Crowley Cancer Center every Monday morning. Wilford Bruce, or WW to his friends, says it's his way of giving back to the place that gave him 2.5 more years with the love of his life.
My wife was diagnosed with pancreatic cancer and given 6 months to live at best.
The treats are for patients like Carly Rutledge.
And one day I was in class, and then the next day I was being wheeled to the operating room and hardly even having any time to process.
At 15, Rutledge was diagnosed with Ewing sarcoma, a bone cancer that spreads quickly. She came here for an experimental treatment.
When I was in chemotherapy, it's 5 days in the hospital of intense, it's very intense. And immunotherapy could not be more of the opposite. I would fly in and out in one day and get a shot.
Mary Crowley just made it through the first phase of FDA approval for the immunotherapy treatment of Rutledge's cancer. Doctors say it's a landmark victory that could change the way they treat many other types of cancers.
Change from an acute, very deadly disease to a chronic disease probably will be the same that we do for patients with hypertension or diabetes. We don't cure them, but we control the disease.
This immunotherapy is a shot typically given once a month. It's a personalized vaccine developed from cells taken from the patient's tumor. The therapy injects customized genes back into the body so the cancer can no longer resist the patient's immune system.
Will the day come when your cancer shot's just like your flu shot?
You know, that's our dream. It alters the immune system so it can now recognize the cancer, whereas before it couldn't. And that's really what a flu shot does. It changes the immune system.
Rutledge is now a college student in remission with no side effects. She's one of the reasons the Cancer Center is one step closer to FDA approval. But there are other success stories. The research began here when Grover Cummings was diagnosed. The Dallas man just wanted to live 6 months to walk his daughter down the aisle. That was nearly 20 years ago. Today, he is alive, cancer-free, and has a 16-year-old granddaughter.
We're actually the only place in the world opening this type of trial.
That's why families like this one are flying in from all over the world for the vaccinations.
We couldn't find anything so much promising in Europe. Dallas' offering is quite unique in offering us this opportunity.
It's hope for future generations, something WW, remember him, takes away every week. Ginger Allen, CBS 11 News.